Thank you, Rachel, for that lovely introduction. So I'm Stephan Kolassa. Nice to meet you all. In my day job, I'm a data science expert at SAP Switzerland. But actually, right now I'm sitting in Germany. And at night, I kind of moonlight as an honorary researcher at Lancaster University at their Center for Marketing Analytics and Forecasting. And today, my main focus is on retail forecasting. And so I'm going to spend the first half of today's meeting talking about forecasting in retail. And after that, I'm going to hand over to Bahman, who is my esteemed co-author in our latest book about forecasting, demand forecasting for executives and professionals, which essentially is generally about forecasting. And we already had a similar call a couple of months back on that book, on forecasting in general. And so that is essentially the general case. And today we're going to talk about the special case. And as Rachel said, we're going to emphasize the common themes about in between retail and healthcare. So, Bahman, please click ahead. So what does a retailer need forecasts for? And about retailers, there's many retailers out there. We typically think in terms of supermarkets, drugstores. We also have many other customers like furniture retailers, booksellers, gas stations, where you buy all the stuff that you're enticed to buying beyond petrol. All right, so what do all these people need forecasts for? They need it for all kinds of planning purposes, and we're actually going to go into more details later on, so I'm going to keep this short. You need forecasts for anything that's forward-looking, any planning purposes, whether it's strategic planning, where do you want to open a store, whether you want to close one, do you want to add a new product line, do you want to change your entire business model from promotion-driven to everyday low price? You also need it in tactical planning, which is stuff like assortment planning. Do you want to introduce this flavor of yogurt into your assortment? Do you want to take another one out? You always need to figure out what's the impact of this decision going forward. So you always need forecasts, whether you call in that or not. And finally, the very operational stuff, which is replenishment planning. That's actually where most of our focus is on. So you want to automatically replenish the shelves in the stores, in the distribution centers, and all that again needs forecasts, because you need to know today whether tomorrow you're going to start a promotion, because if so, you want to order more. You don't want just to replenish what has been sold. You need to replenish in advance in anticipation of what's going to happen tomorrow. Bahman, please click ahead. So here's a time series, and I apologize that this is ancient history by now, but I just love it, and I keep on using it over and over. And it's timeless, because this is something that everybody knows. This is just sales of tomatoes, of one particular type of tomato, because supermarkets sell many different stock keeping units of tomatoes, and this is just one of them, sold in kilograms per day in one particular Swiss supermarket. And you see how they sell up to half a ton or even more of this particular type of tomato every day. So a lot of tomato sales involved here. And you already see some small dynamics in here. You see how year over year it goes up and down a bit. So there's a little yearly seasonality in there. People actually just buy more tomatoes in summer because of tomato salad, and that's still the case. And you see a lot of going up and down within these seasonal patterns, and that's actually the day of week pattern. You sell lots more stuff on Friday and Saturday in retail, at least in Western Europe, than during Monday to Thursday. And on Sunday, it depends very much on where you are. In Switzerland, happily enough for us, the stores are closed. That makes life easy on one hand and challenging on the other hand. And then you have lots of other impacts in here. Bahman, can you please click? And once you have a huge model, and I'm consciously abbreviating here, you can build a model here that includes stuff like the yearly seasonality, the daily seasonality, possibly trends. And what you also have here is price, because price changes actually have an impact. On the top, you see a time series of the price per kilogram in Swiss francs. On the right-hand side, you see the scale for that. And you see that whenever price goes down, sales go up. That's a promotion, right? You reduce prices on tomatoes, and you hope that people will buy more tomatoes, and they actually do so, and we forecast that. And on the right-hand side, at the very right-hand side, you see the forecast. So that's the holdout forecast, what we'd expect to sell in the future per day. You see this fishhook pattern. You see lots of little fishhooks. Every single fishhook is a week. The advantage of Sunday being closed is that you see a little gap between the weeks. That's the Sunday where the store is closed. And in every case, you have Monday to Thursday low values, Friday medium, Saturday high values. And you see how twice we have a projected price change where the forecast actually increases. So the forecast, we don't know how accurate it is, of course, based on this picture, but it kind of makes sense. You see the day of week pattern, you see the effect of a price change. And these are the things that you definitely need to have in retail forecasting. Once you're on daily level, you need to cover the week pattern, the day of year pattern, that's the yearly seasonality. You need to cover the price effects. Bahman, please click. And to be honest, next time you go shopping, just walk the aisles with an open eye and take a look at all the different promotions and other things that are happening in here. So promotions are one of the main drivers of retail sales and one of the most important things when it comes to forecasting, because there is not only price changes. Price changes is typically one of the most important aspects in promotional forecasting or in promotional sales. How much do you reduce price? 10%, 20, 50%? That's important. But what's equally important is all the features that go into a promotion. You could have a TPR, that's a temporary price reduction. You just have the price is going down for everybody. You might have a BOGO, buy one, get one. You buy one product, you get another one for free. Not so much for tomatoes, more for shampoo or other things. And that, of course, also increases sales. You might have something like buy N units of product X at X% off, get M units of product Y at Y% off. That's this cryptic abbreviation here, which honestly only I use, but that kind of encapsulates what retailers dream up. And of course, that gets rather complicated at some point in time because you need to forecast both sales of the leading product of X and of the bonus product Y. You might have conditions. You can only take advantage of this sale if you have a coupon in the app or from the newspaper. You might get other rewards. So if you buy this product, you get airline miles or you get additional bonus points on your shopper card. There's lots of tactics. Tactics is how do we communicate the promotion? If we just say we have a TPR and there's just one little advertisement in the app, that's one thing. But if you have the promotion and you have a secondary placement or a big signage in the store, then that's a different thing. And the exact same promotion can have very different uplifts depending on how you communicate that. So communication is an important feature that we have here. Also have lots of calendar events, Christmas, Chinese New Year, depending on where you are. Day of month effects and paycheck effects. You have other holidays that when the store is sometimes closed, that's a bit of an issue. And that shifts demand around and also changes demand. So on Christmas, store is closed, so demand gets shifted. But of course, there's also changes in demand. Some things are more in demand around Christmas and others are less so. And then you have other things like weather, cannibalization, complementarity, lots of things. Bahman, please click. So Rachel already promised you something about hierarchical forecasting. And the important thing here is that we'd like to emphasize, and Bahman is going to go into this in more detail later on, is that there's different levels of granularity in multiple dimensions in forecasting here. And here I'm talking about retail forecasting and what's important here. And Bahman's going to talk about the same thing in healthcare, essentially. Different planning processes in retail and elsewhere require forecasts on very different granularities. And the three dimensions that we have here, those are the most important ones, are location, product, and time. And you always have to look at where in this kind of hierarchical granularity, where are you for a given forecasting, for a given planning process? If you do store replenishment, well, each store needs its own replenishment. It doesn't help you to know that you need so and so many tons of tomatoes across all your 1,000 stores. You need to know how many tomatoes you need in every single store. So in the location dimension, you need to go down to a single store. In the product dimension, you need to look at the stock keeping unit. And on the time dimension, typically you need to go down to the day for more durable goods, for shampoo and so on, which you may not be replenishing every single day, can probably work on a weekly level. So in the time dimension, there's a little flexibility here. Conversely, once you're in the distribution center, you don't need a forecast on the level of the store. You need a forecast on the level of the DC, so much more aggregated, which makes life a lot easier. And typically in the DC, you might not be replenishing every single day, so you might be able to work on a 2, 3, 7-day time granularity. When you look at all the different aspects that you have here, for instance, workforce planning, when you're planning your workforce in the store or in the distribution center, you don't care which product this particular person is touching. You just need to know how much work is there, whether they're filling the shelves with tomatoes or shampoo, it doesn't matter. So you don't need a forecast on a product level for workforce planning. For workforce planning, it's just enough to have a forecast per typically hour, because you need to schedule people's work per hour or per day, depending. You need it per location, because somebody working in one store won't be much help if you need somebody to work in a different store. So you need to schedule and plan and forecast on location level, but not on product level, but on the total assortment level. How many, for instance, in the DC, how many picks do you have? Or just how much time, how many man hours, person hours are involved? You need to forecast that. So essentially, when you want to forecast, when you want to set up the forecasting process, you need to figure out first, what do I forecast for? And what does that mean in terms of the granularity of the aggregation level on which I need to forecast? Bahman, please click. All right, so next thing is that forecasting also needs to keep in mind higher moments of the time series that we're looking at. These are actually the same tomatoes that we just saw. It's just a different plot. It's not a time series plot anymore. What I did here is I plotted one dot for every Monday, for every Tuesday, Wednesday, Thursday, Friday, Saturday, and each day's sales are one dot in here. And then I put bean plots and box plots over them. And we already see this little pattern with higher sales on Friday and Saturday, and that's good. And Sunday is closed, that's good. So there is some consistency in what I'm talking about. But I'd like to draw your attention at this point at the fact that the boxes get wider as we go through the week. So it's not only that sales go up, it's also that variation increases over the week. And that's a very typical effect, that not only do you sell more on Friday and Saturday, it's also your variation that goes up, the variance. And that comes from the fact that, well, some people go away, go on holiday, go to the beach over Friday and Saturday, they won't be buying any tomatoes. Other people have a big party and have a tomato salad for 20 people, and they buy a lot of tomatoes. And these effects just increase the variance. Why is that important? It's not necessarily important for every single planning process that we have, but it's hugely important once you come to replenishment, once you come to how much do I need to order, because you don't just want to order enough to address average demand. You need to order enough to have a safety amount. You want to satisfy typically something like 90-95% of demands. So that's your target service level. And to do that, you need a safety amount. And since the variability is different over the week, the safety amount needs to be higher on Friday and Saturday, which also has, of course, the effect that, especially in the perishable case, you'll probably have a higher possibility of having stock left over at the end of the day on Friday and on Saturday. And since Sunday the store is closed, you may need to throw everything away on Monday morning, probably less so for tomatoes, but more so for strawberries and other ultra fresh things, sushi, flowers. And interesting tensions appear here between, of course, we don't want to throw stuff away, but on the other hand, we want people to be able to buy what they want, even if they come in on Saturday afternoon. So, and this is not only important when it comes to the day of week pattern, this is also important when it comes to promotions, because promotions have the same effect. They increase average sales, and they also increase their variability, because some people, when there is promotion, will pantry load. They'll just stock up on whatever that is, less so for tomatoes, more so for coffee, olive oil, other high-priced items. There are people who will buy a lot of stuff when they're on promotion, and that just increases the variability, and that makes for more challenging forecasting. And you just need to keep that in mind, however you deal with it. Bahman, please click. All right, and here's what I just talked about. Here's the quantile forecast. So at the bottom, we see this is just the forecasting period for these tomatoes. At the bottom, these dotted lines, those are the actual sales. And above these, we see in dark red, we see the mean forecast. That's what we expect to sell. And above that, we see 3 lines or 3 different quantile forecasts corresponding to 3 different safety amounts. I think it's 80, 90, 95%. And as you see, the difference between the mean forecast and the quantile forecast increases over the week and is larger during Friday and Saturday than during Monday to Thursday. And that's exactly the effect that I was talking about. Bahman, please do a click. And it actually becomes a little more complicated than that because it's not only quantile forecast. So here's our quantile forecast for an 80% quantile for tomorrow. That's just one number. But what we actually need is we need the full predictive density. So we do not only need a forecast of expected sales, one number, and a forecast of 90% quantile of sales. That's a different number, a higher number. We actually need a forecast for how likely is it to sell 0 units, 1 units, 2 units, 3 units, and so on. For fast movers like tomatoes, you could use a normal distribution assumption here. For slower movers like pretty much everything else, more or less, than fruit and vegetables and milk, everything else is intermittent demand, slow moving count data. You need something like a neckbend distribution, for instance. Why do you need these predictive densities? You need them because if your forecast is on one aggregation level and you need to replenish on a different one, or you just need to work your way through the future to account for stuff like how likely is it to go out of stock tomorrow before the next product arrives, and then have sensor data because nobody can buy stuff that is not there, even if they wanted to. You actually need to work your way through the entire convolution of possible sales. How likely is it to sell 0 today, 1 tomorrow, and 1 after that? Oh, I'm out of stock on day 2 because I only have 2 units on hand, and what I'm ordering today is only going to arrive in 5 days. And that gets more complicated, more costly in terms of computing cycles, and more complicated in terms of the software that needs to run all of this. But there is no way around it because this just increases the accuracy of your forecast and for replenishment. You also need to keep in mind stuff like product spoilage. If you have multiple batches of tomatoes and you know that one of them will last for another 5 days, and a different batch will be gone by tomorrow because it's just not looking good anymore, you need to throw it out. What you then need to keep in mind is the FIFO, LIFO behavior of customers. Do customers buy first in, first out, or last in, first out? The retailer wants them to buy FIFO, first in, first out, and first buy the oldest product. That's why the retailer will push new product to the back of the shelves. And of course, customers are not stupid. They'll pick out product from the back of the shelf and try to get the freshest product first. And so there's a bit of a friendly tug of war between the retailer and the customer going on. Because of course, if customer always buys the newest products and the old product that's standing in front of the shelf gets old, gets bad, needs to get thrown out, needs to be marked down, nobody likes that. Yeah, and you need to keep that in mind, essentially. Not for all purposes is that important, but definitely for replenishment. Bahman, do a click. There's different forecasting methods, and I'm just, if you're interested, I couldn't do better than just recommend you read our book. It's actually online for free. I don't even think we have the website, the URL somewhere, but we can definitely, but you can just Google for it. You'll find the book for free online, and it explains pretty much everything on a rather high level. It doesn't go into the details, but it tells you everything about all these methods that are out there. There are workhorses like ARIMA, exponential smoothing, regression approaches. There's more modern methods like machine learning, most of them nowadays being deep learning or boosting. I have seen a few random forests out there. So there's many different ways you can actually forecast these time series. Bahman, do the click, please. Thank you. And the question just is, which of these are appropriate for retail or actually for healthcare, where we see many of the many similar challenges? And one of them is dealing with all these causal effects. So ARIMA and exponential smoothing can deal with seasonality, at least with one kind of seasonality. Once you have these two seasonalities, the intra-week and the intra-year one, that's where ARIMA starts to struggle. Exponential smoothing can be expanded to work with that. It becomes a bit of a nightmare. Machine learning, the bottom ones, on the other hand, they can deal with everything. It's just that nobody understands how they're dealing with stuff. You get a forecast, and when you ask, well, why is that forecast that way? Or once you have a question like, this forecast was bad, and forecasts do get bad. Why is this forecast bad, and how can we deal with it? How can we make sure that this bad forecast doesn't work anymore? And this is something that in the last couple of months, everybody has learned in terms of hallucinations. If you have a ChatGPT or any other Gen AI method, it will hallucinate. And there's an analog. When you use an AI method for forecasting, it will also give you hallucinations in forecasting, sometimes rarely. But when it happens, you don't know where it comes from. You don't know how to make sure it doesn't happen again. And that's always a bit of a problem with machine learning. They're black boxes and nobody understands them. Customers like to understand things. And that's why we personally, the SAP, we use regression. So I'm not going to turn this into a commercial, but this is just why I personally actually prefer regression. You understand it, you can deal with all causals that you have in here, and it kind of works. It's not as sexy as machine learning, but it works. Bahman, do the click. Thank you. Dealing with aggregation. So we've talked about why we need the aggregation. It's just that because, well, different planning processes need forecasts on very different aggregation levels. And so how do we deal with that once we want to forecast? Well, first off is you need to adapt the forecasting process to what is actually needed in the subsequent decision. And actually, that's the link to the book, this dfep.netlify.app. That's where you see the book, because this is just one of these pictures, this flow chart. I took that from our second section, which just discusses that you should first think about what you're forecasting, why you're forecasting, and then adapt the tools. Because often enough, I see people saying, I have this tool, how can I use this tool to forecast something? And then very often the answer is you shouldn't be using this tool in the first place. You should be using something different, because this tool is not appropriate to your challenge, to the question, to what you're trying to achieve. You can use regression and machine learning methods. They can use predictors on various aggregations. ARIMA and exponential smoothing cannot, at least not out of the box. You can always do some bells and whistles and just adapt them, but then they turn progressively less ARIMA-like and exponential smoothing-like. There are methods that have come up in the last couple of years under the moniker of hierarchical reconciliation or optimal hierarchical forecasting. And that is actually a very smart approach that leverages forecasts on different aggregation levels and then combines them essentially and reconciles them and turns them into hierarchically consistent forecasts. And the important part here is these typically improves forecasts on all levels. Again, if you're interested, I just put in the DOI of one recent review paper. We also have one chapter in our book on that. It's a very smart approach, very, very good, very smart, very helpful. The main challenge is that it's numerically complex. And once your hierarchies become large, and by that I mean more than a couple of hundred nodes or something, it becomes very, very unwieldy and very problematic. And it really turns into a numerical issue here. And the important thing is that people don't have on the radar sometimes is that this hierarchical forecasting also does not only work in the product and location dimension, it can also make it work in the time dimension. So you can reconcile daily and weekly and monthly forecasts using the exact same machinery. That's a MAPA algorithm that's been proposed by Kurentzis et al. In 2014. That's actually, well, it's the same approach applied to the time dimension. All right, and actually I'm done. Bahman, over to you.
Thank you so much, Stephan. Can you hear me?
Yeah, lovely.
Okay, wonderful. So my name is Bahman. I'm a professor at Cardiff University, and I'm currently a research fellow in Montpellier, in south of France. So it is great to be back to this sort of talk again with Stephan. So Stephan highlighted some important principles in like the forecasting process. So instead of repeating what he said, I think most of them actually are also, they remain valid in healthcare. So what I plan to do is to actually show you a couple of examples or the forecast application in healthcare. So all these are publications. All of them are available, I think, accessible online for free. If not, you can send me an email. I will send you the PDF. But all of them, they are also accompanied by R codes or Python codes. So again, the codes are for all of these papers are accessible on GitHub. So you may find them online. Otherwise, please get in touch and I will also share that. So just before going through these examples, what Stephan highlighted in retail forecasting is exactly true in healthcare as well. So typically, I mean, you do the forecasting because it could be helpful in maybe questioning your assumptions about the future, but also help you to inform decision making and planning. So you have to make a decision, and this decision somehow dictates what you need to forecast. And there are typically different dimensions to the forecasting problem. You may have a dimension about the decision level. This is also somehow related to geographical level, I would say, that range from individual level, like a patient level, to the country level. So between this really can vary. At the same time, you may have also something about the time granularity. So you may need something from a forecast from a timestamp to yearly. So it can go from there to, I don't know, 15 minutes, half an hour, then hour, day, week, months, etc. So in addition to this, you may also have other dimensions, like what I call attribute here. You may also need forecasting for a specific age group, a different sort of priorities you may have in, I don't know, in call centers, for instance, different type of injury or diagnosis, gender, and this sort of attributes. So when you make decision, again, you are probably in one of this, a combination of this, or there are cases where actually you may need multiple sort of combinations to produce a forecast as well. So, and similar to retail forecasting in healthcare, you also do forecasting to inform decision, strategic, tactical, and operations. And there are many different examples for each of these categories as well. So another important thing about probabilistic forecasting, all of the examples I will show you later, they are actually generating probabilistic forecasting. So a probabilistic forecast produces a list of possible outcomes and their corresponding likelihood. Here is just an example, is actually monthly time series. So the yellow is the actual, and then you see the distributions for 12 months forecast the right-hand side of it. And then if we focus on the last one, you see that in the x-axis, I have possible outcomes that range from something around maybe 700 something to 1,300. And each of this, they have a likelihood that highlights the possible outcomes with that likelihood that I mentioned. Now, how to deal with this predictive density, or we may also call it, I call it probabilistic forecast, but predictive density or forecast density is really for you and your team to decide how you can use it. Because, you know, sometimes we can use this and use it as an input for an automatic decision making. But in my experience, in many cases, this is going to be used in a manual decision making. So somehow you present this and people make decisions based on this information. And I know this is challenging because there is a cognitive load. You know, we present this to people, there are a lot of information. And also it requires maybe a level of numeracy or literacy in modeling or statistic to understand that. So it is important to see what you want to communicate or use from this entire distribution, because there are a lot of information here. For instance, you can get the mean, median, different quantiles, prediction intervals from this, and probably this is what you communicate or use for your decision making as well. So another important thing about the probabilistic forecast is, odds may have less importance. So instead, what it matters really, it believes in alternatives and being prepared for them. And of course, being prepared entails considering this alternative core of actions that is only possible if you produce a probabilistic forecast. But if you have only one point, So you wouldn't have any chance to see those possible outcomes or what would be the course of actions that you need. So I think I just wanted to highlight these two important things here. Now, the first example that I look at it is actually in the level of the granularity that I showed in the diagram is a patient level. So this study focused on forecasting length of stay in mental health services. If you work in this area, you know that mental health, length of stay in mental health, or in general, actually in any sort of services, has this skew distribution, which makes it challenging to forecast. We have 5 years of data for this exercise, over 3,500 patients. And then we have predictors from the inpatient referrals, but also from a community mental health service, which is a service comes before the inpatient mental health. And we use different predictors, including the patient history, the calendar-related causal factors, the service workload, so how many people are already in different wards, and also some predictors from the community mental health in order to provide a forecast for length of stay for each patient. So another important thing is at the time of admission, a clinician or a team of clinicians or experts, they also provide an estimated length of stay for each patient. So our idea in this work was how we can produce a probabilistic forecast first, and then also combine that with the estimation provided by the experts. And we use a technique called quantile regression averaging, but we need to use a modified version of that. Basically, here we provide quantiles using a machine learning approach, which we call it AI here. And for each quantile, which ranges from 1% to 99%, we also have an estimation from a clinician, and we do it for each patient. And then somehow we average them to create a new quantile estimation. If you want to go through one simple example here, so here there is an example. So we have a patient. This patient has some characteristics that you can see here, as I said, about the patient history, service workload, etc. So that would be some characteristic of that patient. This shows the time of admission, and then this shows the discharge time. And of course, the difference between these two is what we call the length of stay here. So in this section in B, so we have the point estimate for length of stay from the clinician, from the machine learning model, which is the quantile regression forest here, and then also from the method that we proposed, which is a modified quantile regression averaging. Now, here in the bottom, you see basically the probability distribution, which is in this case, we have showed this as a cumulative density function instead of a probability density function. So you see basically how we provide the different outcomes in here, and then the cumulative probability that changes from here, we go from 0 to 1. And this shows for each patient what is basically the density forecast that we have highlighted. You can also categorize them if you like. Instead of showing or using the entire distribution, you can, again, this is something that you have to decide as a decision maker how you do it. But here, for instance, we use if the length of stay is between 0 and 30 days, we give it a color yellow, green, and then between 30 and 90, yellow, and then more than 90, red, and then we can calculate also the probabilities for this. But again, this is something that you can do as a decision maker. The second example is about the hourly emergency department arrivals. Again, this is a probabilistic forecast. Again, if you work in A&E, you know that this is a typical sort of figure that you see here. And this highlights also some features Stephan mentioned. So it has seasonality, but it has also multiple seasonal cycles, not only one, but more than one. Here we have actually hour of the day. So there is the impact of that, but we have also the impact of a day of the week, so which is more pronounced in this graph. But we have also an interaction between these two profiles of hour of day and day of week, which is crucial when you build the forecasting model. So you need to make sure you consider them as well. So this plot also highlights the impact of some special events or special days like holidays. And you can see that for some days you have extremely low or extremely high arrivals, and you need also to make sure you take this into account. So we have 6 years of data for this. The forecast that we want to produce is for 48 hours. So there is what we call the forecast horizon. And then we use a range of different models that you can see, here. I mean, these are probably not the best names that we could choose for this models to present here, but I can tell you actually what is covered in this. So it is important to, ensure that multiple seasonality is, your model taking into account multiple seasonality and the interaction that I mentioned. We also use temperature, the average temperature, and then public and school holidays as predictor here. So here we have some methods that Stephan also highlighted, like exponential smoothing, some simple benchmark like seasonal naive, and also a version of exponential smoothing, which is more, used to include also predictors, because exponential smoothing by definition cannot have external predictors, but a version of it called Adam ITX, we can have that. Some other models are more also out of the box, like Profit. You may have used this before, or Gradient Boost, for instance. These are, again, something that we used as automatic approaches, but we have also worked a lot on developing models more specific to this problem. And we have used a lot of different distributions. So like we have used the normal truncated distribution, we have used the gamma distribution, Poisson distribution, negative binomial, and T distribution. And actually, we found that this is crucial when it comes to forecasting hourly emergency department arrivals. So that actually matters more than the choice of the model themselves. And so the features that you considered and also distribution has a very important. Another important thing you find out is non-parametric distribution, like the quantile regression, for instance, do not perform as well as the probabilistic forecasting produced by parametric distributions. And then, of course, as I said, we highlighted also the out-of-the-box do not perform as well as the considered statistical approaches. It means we spend a lot of time to build those models rather than just using something automatic. So the figure here also shows two things. In the x-axis, we have the speed. This is the computational time. Of course, it matters as well, especially in hourly forecasting, because you repeat this task many times. And then in y-axis, you have accuracy. So you have the accuracy of the point forecast here, but you have also a way to evaluate the probabilistic forecast using the quantile bias and then pinball. So the quantile bias is more about, so with pinball, they look at the different aspect of the probabilistic forecast. And we can, I mean, it's difficult to have an exact relationship between the speed and accuracy. But what is important, of course, there are some methods where they produce accurate forecast as others, but they are extremely slow. So maybe you don't actually need to have those methods in your inbox. There are also some very simple approaches we have considered here. They have also very good performance, so probably not very different from more complicated methods that we have here. So again, this is something that you may consider and when it comes to which model you use in practice. So this example is about forecasting daily emergency department admissions with a focus on special events. So here we use a different way to visualize our data using a polar coordinate system. Again, what is clear from this is, we have Mondays, which is not probably very clear for you to see, but Mondays always a higher comparing to the rest of the week. So there is a day of weeks seasonality here. We have also highlighted the effect of some holidays. So you can see that some holidays are having an impact. Here we use many different type of holidays, but also sport events. This actually shows the output of our model, so how our model produced the probabilistic forecast using this fan chart. The model is used lasso regression. It is a high-dimensional model because it has many predictors, but lasso helps, to automatically, get rid of those that are not very important as driving factors. So the model uses autoregressive. So what happened in the past, the trend, week of day effect, but also the special events that I mentioned. So what is really important from these two graphs, or the message from these two graphs, is there is a huge difference between the method that we propose that includes the special events and the method that does the same but without special events. So there is a huge difference between them, and this highlights how important it is that your model takes into account the special events. And it is better to do that rather than just judgmentally use your own expertise to say, well, Christmas is higher or lower. The model can take this into account, and you can leave this task to the modeling exercise. This project looks at hierarchical and group time series in ambulance services. So we have basically the time series of attendance of incidence attendant. This is disaggregated basically into different regions, and then the different health board. This is what you see here, and then group into priorities and nature of incidents. So this will give us a lot of time series, and as Stephan highlighted, this actually becomes quite tricky to forecast because we have 1,530 time series across all this hierarchy. Well, you may also ask yourself whether this is really needed, and this is why I said at the beginning you need to also tailor your forecast exercise to the decision that you want to make, because running an exercise like this maybe every week even is a huge task to do. So we have this hierarchical and group structure, and here is just an example to show you going from the total country to the bottom series, which is the combination of this nature of incidence at the bottom. The patterns that we see changes. So at the bottom, typically you have more noisy sort of time series that are more difficult to forecast as well. This is also an example of how we produce the forecast in this project. Again, it's a probabilistic forecast, but then of course it's hard to plot 84 days ahead because this is what the focus of this project was. So here we just provided the example for 1 week or 7 days ahead. In terms of the models that we use here, we use again what we call the stationary, a simple model. This is like using a modification of the history. So we have a distribution of the history, and then we take samples from that to use as a forecast for the future, but also some models based on exponential smoothing, and two models using regression, the TSGLM and GLM, and then an ensemble model. So what was also interesting to see here is the ensemble model that we used across the hierarchy was a more accurate forecast rather than using just a separate model here. So this project is a different sort of time granularity. We are here looking at forecasting and combining with the simulation model for mental health workforce planning for 6 years ahead. But we look at the monthly granularity basically, so that make it as a 72 months ahead. So here we have a data from June 2018 to 2020, December 2022. We have the data for 8 different publicly available sources. We have the data for 7 NHS England regions and 45 integrated care boards. So this data basically has been collected for NHS England. Initially, we wanted to do the project for NHS Wales, but the data was not available, so we did it with the data for NHS England. So here you see the sort of predictors or causal factors that we identified initially to use. This is also with the help of domain knowledge experts and NHS Wales working in mental health. So we have the target variable, which is the headcount for mental health nurses. This is what we want to focus, and we identified different causal factors from the demand side, but also from the supply side. But we also do a lot of what we call feature engineering to manipulate this data in a way that is suitable or more useful for our modeling. So the diagram in left-hand side briefly shows the different steps that we go through. So in the first step, we collect this data, we bring them together, and we do the feature engineering. But you may also know that when we have causal factors and when we do forecasting, sometimes you need also to produce a forecast for those causal factors to use in your models. So for some of these predictors, we had to do that. So we use also a model to produce the forecast for the predictors that we used in the forecasting model. So we build a forecasting model with some simple models, but also some more advanced machine learning, deep learning models. And then we all use an ensemble model. One particular challenge that we have in long-term forecasting, as you may know, is performance evaluation. So in a typical forecasting exercise, like short-term or even mid-term forecasting, if of course you have enough data, you do splitting data into train and test, and then you use cross-validation to evaluate the performance, but this is not possible with long-term forecasting. So to deal with that, what we do, we create also what we call the simulation or stock flow simulation model. The idea of this is basically to bring the demand side, what we forecast, but also with the supply side together, and then do some sort of what we call what-if analysis. So here you see one example of it. The first one is just the forecast that we produced, and here we just plotted the prediction interval for 6 years ahead. But in the bottom, you see just an example of the last part of the modeling, which is a stock flow simulation model that brings the demand side and supply side together, and then it does some what-if analysis. For instance, in this case, what if recruitment rate changes to 10%, 20%, and 30% from what we forecasted, and how that affects then the workforce needs in mental health care. I don't know if I mentioned it or not, but actually in here we just focus on nurses, adult nurses. In this particular example, but the model could also be generalized to other sort of healthcare modeling for workforce. So here in the y-axis, you see what we call the shortfall or surplus. So it's basically we calculate the difference between the demand and supply, and then we see how different scenarios affect this shortfall or surplus. And that's the purpose of actually linking them together. But for us is a way as well to deal with, okay, we can't evaluate forecast accuracy, but then we can link this to a simulation model to do more what-if analysis, and hopefully that helps decision maker. And finally, this is not about healthcare, but this paper is not about healthcare. It's more like a methodological paper, but I'm sure all of us, the sort of data we use in our work somehow affected by COVID-19 in different ways. So this is the first plot is the data set from monthly A&E admission in Wales. And again, you see clearly that how COVID-19 affected this data. So the question that we have asked is, what can we do with this data? How we handle this interruption, the time series, and how we can forecast this. And this is not only of course, in healthcare, every other domains somehow are affected by these interruptions. And in this work, we have proposed 6 different strategies to deal with this interruption. So we can use what we call the highly adaptive models. This is typically the sort of models like exponential smoothing. They could adapt to change. Or we can use also what we call the intervention model. This type of models are used a lot in healthcare, by the way. When you want to implement an intervention and you want to see how that intervention would affect the values or observations that you had in the past, but now you're interested in how that would affect them in the future. You can do something similar here. We can also set the periods affected by COVID to missing. There are methods that can handle this. We can also use an approach that assumes COVID didn't happen. So we need to estimate that period and then use them in the time series to forecast the future. Another approach would be to downweight the interruption period. So again, we need to develop a weighting system where we have the periods not interrupted and periods interrupted, and then create a balance between how much weight you give to the interruption periods comparing to the periods that are not interrupted. Another approach would be basically to do what we have proposed as 5 approaches and then combine them together to create an ensemble. And this has somehow both advantages and disadvantages of the model proposed above. So if you are interested in this paper, this is also available online, so you can read more detail about the proposed strategies aligned with the R codes proposed that you can maybe adopt to your own cases. Stephan? Do you want to go through this, or I can go through this?
Whatever. Okay, so thank you very much. A couple of takeaways, and we aligned on that because, yeah, as we said, there are common themes that emerge from both retail and healthcare. So key thing is your forecast is a means to an end. It's not an end in itself, much as forecasters might think otherwise. It's important to figure out what you need to forecast for, what's the process you want to support. And once you've understood what you're forecasting for, that's when you understand what aggregation level you need to forecast on. And then you can dig through your toolbox and figure out, okay, which tools do I have, which forecasting methods, algorithms, and so on, address the challenges that I have, address the requirements, and both in terms of aggregation and in terms of black boxiness. For instance, Bahman has been talking a lot about black box algorithms and which have their use, and in other cases, you need a white box. You need to understand what you're talking about. It's always important to integrate domain knowledge to identify special events or any other causals, and that's COVID, both for healthcare and for retail. For retail, it's promotion. For healthcare, we saw that. To understand why you're forecasting, what's happening, what are the drivers? Can you understand the drivers? Can you forecast the drivers that you need to forecast so you know when something is going to happen? There are methods that can affect special events and that can adapt to special events, that can capture the effects and forecast them out. And that's important. And there's also simpler methods. And as Bahman said, for some of his analyses, sometimes the simple methods are good enough. They're usually faster, they're easier to understand, easier to communicate, even if they do not capture special events. It's often quite a good idea to run the very simple methods benchmarks in conjunction or alongside the more complex methods. Surprisingly, often it's hard to beat the simple methods. If you forecast in the time granularity on sub-daily level or even on daily level, that's when you need to account for multiple seasonalities, so day of week, day of year. Once you're sub-daily, you have hour of day or 15-minute bucket of day, and then you have 3 different overlapping and interacting seasonal patterns, and it's important to really capture that if it's important. I mean, if you just need to figure out how many cars essentially you don't need a forecast on sub-daily granularity of your demand, typically not. It's important, or it's usually important, to assess the level of uncertainty or to forecast the level of uncertainty, especially if you do some kind of capacity planning, if you want to just not only have capacity or safety stocks or capacity for the mean demand, but also for high demands, for spikes in demand. That's when you need a quantile forecast or predictive density or a distributional forecast. There's different terms for it. Yeah. Long-term forecasts are inherently more challenging. As I say, forecasting is hard, especially about the future. And that's where judgmental adjustments, judgmental approaches, and scenario planning also. So we need to plan for multiple scenarios and think about how important, how realistic, how likely are different scenarios. That's when you want to include these. It's not important when you forecast your strawberry sales for the next couple of days. You don't really need a strawberry scenario plan. But it's important when you think about, do I want a new hospital here or there or somewhere completely different? That's where you need a long-term forecast about the demand for that hospital. And that's where you really need multiple stakeholders involved and to have them go through scenarios. That's my going through this slide and doing the takeaways. Bahman, anything to add?
No, not really, Stefan. I don't know if there is, any time for questions or.
You forgot to put your email address on that slide.
No, I don't. I think that was deliberate. I mean, it's clear, isn't it? He's forecasting a lack of emails to himself. Is what I see here.
I like a demand.
Don't worry, everybody. I know his email address. I'll share it with you after if you want copies of any of the references that you maybe can't get hold of. So yeah, we are slightly out of time, and so you're honoured in that I normally do like a straight 12 o'clock bye, but I wanted to finish off, and I felt so guilty about arriving ever so slightly late this morning. So I would just like to say I will flick over to the questions that we've got. We won't have time to go through them, but I will, if it's okay with you, if I could share them with you afterwards. In fact, I'll just share my screen. And maybe if you could give us some responses, and I can share them to people after the session today. I think you can see. Can you see my screen, or have I shared something completely different?
Yeah, we see it. We see it.
Okay.
We can start talking, and let's see who.
So I mean, I'll just pick on one because I think this one here, which is the 6 years A&E data. You've mentioned COVID a couple of times as a special event, I suppose, very special. So maybe just pick that one and pick one of the others, and then we can perhaps pick on follow the other ones up after the session today. Who's going to do that?
Yeah. Oh, it's
answer whatever you like. I really don't mind.
Yeah, I mean the sort of in the papers that I showed, actually it doesn't actually include the COVID period, and we don't actually use it for COVID. But I think in general the sort of strategies that I showed in kind of the last slide, that would be the response to that. But then which one actually works best for the A&E? I think this is something that maybe you need to look at. So I could share the paper. I don't know whether I could share the paper here, because it is.
Yeah, what we do or used to do for COVID was we just put in a predictor to say this was one lockdown, this was a different lockdown, and there was yet a third kind of lockdown, and let the model figure it out. That was the only way to deal with it with thousands of SKUs that you have. And the advantage is that if ever something like that comes again, we can learn from it, and we may be able to predict the effects of future lockdowns, even if they'll likely be quite different. And the advantage for us is that we don't collect much data beyond 2 years, because retailers change their assortment so often. And so it's all past history by now.
Yeah, absolutely. Okay.
So it seems like, sorry, I can't share I can't use the chat here or whatever, but I will email you the paper, Rachel, and
I'll share it with everybody after. Yeah, sure. Thanks for that. So maybe one more question, and then we'll finish up. So you can take your pick.
I would talk about this communication of uncertainty, top left one. I would say, as always in communication, it's hugely important to tailor your communication to your audience. If your audience is a different software system that uses your predictive uncertainties to do capacity decisions, like our automatic ordering system, well, then you just need to give it probably full predictive densities in some way, parametric, non-parametric, whatever. If your audience is somebody who's non-technical and you just need to explain to them what's happening, that's when you want to have something like a 90% quantile forecast and perhaps call it 3 different scenarios: optimistic, most likely pessimistic scenario. So just understand who you're talking to. If you walk into an unfamiliar meeting room, you don't know who you're talking to, then read the room and try to understand what people are comfortable with and what they're uncomfortable with. And it's always a question of building trust. People don't necessarily need to understand everything. They just need to trust you to understand what you're talking about. And so essentially tell them enough that they trust that you know what you're doing. That's my guiding principle so far.
Yeah, I just maybe add this. I mean, because communicating uncertainty is sort of controversial thing as well. Some people, they say you shouldn't communicate uncertainty because different people may take actions based on the tail of your distribution. But in my opinion, the uncertainty should always be at least. I mean, the probabilistic forecast should always be generated. So we have to make it. We have to have this distribution. But then what you communicate from it is a different question. That's why I said, in my opinion, it should be a decision. You leave it to the team. They make a decision what they can communicate from it, because the entire distribution is a challenging thing to understand, but at the same time it brings also a cognitive load. Your mind would be busy with so many things that you wouldn't at the end understand what this means. So I think I would say that this is important to have a team and then see which, sometimes you have to communicate maybe a 5% quantile to people. That would be maybe the thing that you do. Sometimes is a prediction interval. Sometimes it might be a 90% quantile that you communicate. And just to add to this, I'm actually doing a study at the moment with neuroscientists looking at the cognitive impact of the probabilistic forecasting. So how it is used and how it is also affecting the decision making. So hopefully that would be in maybe 2 years' time.
Yeah, it'd be interesting to see how that comes to fruition. I'd be very, very interested in the results of that. I'm thinking how it's relevant to some of the things I'm working on at the moment. I might be in touch, Bahman.
Absolutely, yeah.
Oh, fantastic. So I will draw us to a close, but not without saying thank you again. And just if you can't see the chat, somebody has said best forecasting talk I have attended. So there you go. There's a quote for you. And I really appreciate you coming along. I know I've put a link in the chat also to the Hacker eLab that you did last year. I do hope you'll come back again. There's been so much interest in this today and in general. Lots of people saying lots of lovely things. So thank you again for coming. I'll send those questions to you after the session, and hopefully you can just respond to one or two of the other ones which are coming in as well, and maybe links to or PDFs of the hard to reach articles that you might have mentioned, or people have to, they might have to pay for. They're not subscribed to the right websites or whatever. Thank you again, both, and I hope to see you again soon. Thank you everyone for coming. See you in 2 weeks.